Hello everyone, I am Dr. M.V. Chandrakanth. I am an oncologist in Narayana Hospital, Kolkata. Well, April is the head and neck cancer month, and I will tell you why this head and neck cancer is important. So, head and neck cancer is one of the most common cancers in India, and it is different from other cancers because it is visible. It has social implications. If I have a pain in my tummy, it's not visible, so it has not many social implications. But if I have a swelling on my face, it's directly visible and it has a lot of social implications. And also, we have important organs in the face like chewing, swallowing, taste, smell. Without this, I cannot live. So, head and neck is one of the most important areas of our body. Social implications, functional, eating, swallowing, talking, all are with head and neck. So therefore, cancer of this area is of utmost importance. Well, why does head and neck cancer happen? I can tell you the most important cause of head and neck cancer is tobacco. So tobacco doesn't mean only smoking. Smoke less tobacco like pan and gutka are almost equally dangerous. And if you are using both, it is very dangerous. So therefore, if someone is listening to me, please quit tobacco right now. Otherwise, you are at a high chance of developing head and neck cancer. Well, there is some good thing about head and neck cancer. Head and neck cancer does not happen in a day. Before head and neck cancer happens, it gives you adequate time to fix it. So before an obvious head and neck cancer happens, you develop something called pre-cancerous conditions. Like for example, a white patch that is not going away, or a red patch. Remember, if I have an ulcer in the morning and in 2 days it goes, it is not cancer. If you have any ulcer that is not going away over a period of 1 to 2 months, it is persisting or worsening, that is a danger sign. So be aware of this pre-cancerous conditions of a white patch or a red patch. We call it as leukoplakia or erythroplakia. And number 2, if you look into the dangerous signs, any painless ulcer anywhere that is not going away is a danger sign. It is not just an ulcer, it can be a cancer. Number 3, if you have change in voice for no reason, I had cough and cold, I had change in voice and it went away, that is not cancer. But if I, for no reason, I have a voice change that is happening and that is persisting over a period of 1 to 2 months, remember this can be cancer. And number 3, difficulty in swallowing for no reason. If it is persisting and is worsening, this can be the danger sign for head and neck cancer. Painless ulcer, change in voice, difficulty in swallowing. These cannot be ignored if these are persisting over a period of 1 to 2 months. Okay, so well, if you present with these danger signs, what is the advantage? So you need a biopsy to prove what it is. So biopsy is not harmful. There are a lot of myths that if I do biopsy, it is going to spread. This is a myth. You have to do a biopsy to prove what it is. If you are presenting in a pre-cancerous condition like a leukoplakia or erythroplakia, it can be easily taken care of by small excision itself. If you are able to present at least with an ulcer, then it can be easily operated early and it can be got rid of. So the earlier you present, the easier the treatment, the chances of cure are higher. And for example, in areas like throat cancer, there is no need to operate. You can do something called organ preservation with radiation and preserve the organ by curing the cancer. However, if you present in a delayed manner, then you may need multi-modality treatment including surgery, radiation and chemo. Therefore, the key is present early and do not ignore these danger signs. So in the present day, what if it's a stage 4 head and neck cancer that has spread elsewhere? You would see those photos on the cigarette packs and all that. Nowadays, we have so much research in this area. We have got something called targeted therapies and immunotherapies. This has changed the landscape of treatment of head and neck cancer. Even a 4-stage head and neck cancer, with optimal treatment is able to live longer. So well, before I conclude, I would again alert you that head and neck cancer is different because of its social and functional implications. It is not a simple cancer. It is visible and it causes a lot of emotional trauma. And number two, we know the cause of this cancer, and that is tobacco. You quit tobacco, the risk of head and neck cancer comes down drastically. Therefore, never let the never, quit right now. And then thirdly, be aware of danger signs. A simple ulcer that is not going away is not a joke. It can be cancer. Change in voice, difficulty swallowing cannot be ignored. And very importantly, if you present early, the treatment is simple and it can be completely cured. So with this, I thank all of you for your patient listening.